Okay, Mike, here we are in the office to do the physical exam. I'm going to start just by reviewing your vital signs, your height and your weight that we got at the nurse's station. Do you have your height and weight?
My height was 5'8", and my weight was 215 pounds.
Great. Your oxygen saturation was 100% on room air. Your heart rate was 68 and your temperature was 98.2. I'm going to go ahead and get a blood pressure here. I just want to mention also I took my jacket off to do the exam because it's just a little bit easier for me to move around if that's okay with you.
That's okay.
Okay. I'm going to borrow this arm here to check your blood pressure. It's a little chilly, I'm sorry about that. And just relax this arm down. There you go. Should have eaten more Wheaties today. It's 123/78, so fantastic. Let me just get this out of the way here. Covers your weight and your vital signs, and we've already talked about all of your general health status things. So actually I'm going to go ahead and just start your head to toe, and we're going to start right at the tippy top. So we're going to look at your scalp. I'm going to have you bend your head forward for me. I'm going to inspect your hair and your scalp, looking for any lesions, bumps, bruises, open areas, rashes. I see nothing here. Your hair is all intact. I'm going to swing around just so I can check the back of your head. And I see that all the skin and your scalp is perfectly intact. I'm going to have you take your shirt off for me so I can take a look at the rest of your skin on your body. Take that for you.
Yep.
I'm just going to take a look at your precordium here. I'm going to palpate a little just for temperature. Everything feels equal on all sides. I'm going to take a look at your nail beds, see if they're clean, that your cap refill is good. And I'm going to take a look at your legs here, checking on both sides, checking your pulses as we go down popliteal, and your pedal, and your ankle pulses. I'm going to have you just push down for me with your feet and check range of motion while we're here. I'm just checking your cap refill and your toes as well. Your skin all looks good. I'm going to back up to your wrist here and just check your radial pulses while we're here, and your brachial pulses. Excellent. Skin of your back, I'm going to take a peek at. I'm just going to palpate for tenderness. I don't see any rashes, any open areas at all. Any concerns about your skin?
None.
Okay, so we're going to go back up to your head. I'm going to feel for the lymph nodes in your head here. Your pre-auricular, and I'm just going to be going on both sides of you here so I can feel both sides. Look towards me a little. And your posterior auricular, tonsillar, parotid, submandibular, submental. Bend your neck forward a little for cervical and occipital, and then supraclavicular here. Any pressure, pain at all with any of that?
I didn't feel any, no.
Wonderful. I'm going to go ahead and palpate your sinuses and your face while we're touching all of your skin for any tenderness here, any concerns at all?
No.
Okay. Fantastic. So we're going to go ahead and start with your eyes, checking the external structures of your eyes, checking the conjunctiva in your eyes, the whites of your eyes, your eyebrows, everything looks symmetrical and even. I'm going to use a little light here for some of your eye exam. I'm going to have you first just look at my finger and follow with your eyeballs, checking for muscle movement. I don't see any issues. We're also checking your ability to follow my finger through all of the fields here. And follow towards your nose, very good, and away. So I'm going to shine a light to check your pupils. If needed, we'll dim the light, but I think we'll be okay. Little bright here, very good. Little bright here, very good. And I can see consensual response as well as accommodation in both your eyes. I'm going to check your visual acuity, have you cover your right eye with your right hand and read the smallest letters on the chart that you can.
A, B, C, D, E.
And switch hands.
A, B, C, D, E.
Fantastic. Ever any trouble with your vision?
I do not.
Okay. We're going to go ahead and move on to your ears. I'm going to inspect them both externally and internally, looking inside. Any pain when I palpate on your tragus or your cartilage or your earlobes?
No.
Great. We'll do both sides here. Any pain here with palpation, and I'm just going to take a peek inside. So you're speaking to me in a normal voice, which tells me that you can hear me and understand me as far as commands. I'm going to just check your ability to hear me when I whisper.
14.
And if you could repeat the number on this side as well.
22.
Excellent. Any issues with your hearing at all that we should be concerned about? Fantastic. I'm going to go ahead and check your nose. We're going to check for patency. I want you to take a deep breath. And through the other side. And I'm going to have you tilt your head back so I can take a peek up in your nose at your ears. I don't see any concerns about your mucosa, and you seem to be breathing freely. Your nose is midline. It doesn't appear to be broken or injured in any way. Any concerns about your nose? Fantastic. We're going to move along to your mouth exam. So first I can visualize the outside aspects of your mouth. Your lips are a little dry, but it is winter, so chapstick is your friend. I'm going to have you open up your mouth so I can take a look at the internal structures. Stick out your tongue and say, ah. I see no tonsils as we discussed, and your uvula is midline. I do see the roof of your mouth is pink, and your mucous membranes are pink and moist. Can you put your tongue on the roof? Thank you. I see no issues here. Everything looks well intact. I do see some filled cavities. Smash some of your teeth. Excellent. And puff out your cheeks for me. Fantastic. Any pain at all with any of those movements?
None.
Excellent. I'm going to have you look up at the ceiling. I'm going to palpate your trachea here, just to ensure we're midline. I don't see any deviation. And I'm going to step behind you so that I can feel your thyroid as you swallow. Fantastic. Any concerns there?
There's none.
Okay. So, moving down, I'm going to go ahead and take a feel and a listen to your chest in the front and the back. I'm just going to palpate and percuss here. Over sounds of your lung, I'm listening for resonance and air sounds. And I'm going to listen. My stethoscope, have you take some nice deep breaths here. Fantastic. I'm going to listen in the front. Great. Any concerns with your breathing at all?
None.
Okay. Before we move on to your cardiac assessment, I'm going to back up and just feel your temporomandibular joint. I should have done that when I was looking at your face, but got a little distracted by your lung sounds. Go ahead and open up your mouth for me and close. Any clicking or pain involved in that at all? No.
No.
Fantastic. So I'm going to, again, inspect your precordium, and I'm going to go ahead and listen to your heart sounds, listening for S1 and S2. And I'm going to stop down here, your point of maximum impulse, your apical pulse here. I'm going to palpate your carotids. And I'm going to auscultate them as well. Great. I don't hear any murmurs or adventitious heart sounds at all. Any questions or concerns about your thoracic assessment in your lungs and your heart?
Not this time, no.
Okay, great. You can go ahead and lie down on the table. I'm going to do an abdominal assessment. I'm going to start again by just inspecting the skin of your abdomen, looking for any lumps, bumps, bruises, any abnormalities. I don't see anything. I'm going to percuss gently through the fields of your belly, listening for resonance, and I hear dullness over your liver. I'm going to auscultate and just check your bowel sounds in 4 quadrants. Everything sounds fantastic. I'm going to do some palpation here. Start a little bit lightly, feeling for lymph nodes in your belly, any bumps, bruises, or points that seem to be uncomfortable. I'm going to go a little deeper here, have you cough for me, and check for hernias. Fantastic. And I'm going to palpate your liver here. And I don't feel any issues with that at all. I'm going to have you go ahead and swing your legs back up. And I'm going to check your reflexes, okay? So we're going to start here with your arms, with your brachial reflex. And we'll do both sides. Fantastic. This is your tricep reflex on both sides. And your radial reflex. Fantastic. We're going to move down to popliteal. Patellar. Kneecap here. And kneecap here. And your Achilles behind your heel. Fantastic. No issues with your reflexes at all. Good. Moving on to some more musculoskeletal questions. I'm going to have you put your arms out for me and bend your shoulders, bend your elbows. And I'm just going to palpate here your joints, your muscles for symmetry, any tenderness at all here.
None.
Okay, rest them down. I'm going to palpate your hips here. Have you move your head from side to side against my hand. Good, and shrug your shoulders up and down. Very good. I'm going to have you bend your knee out and your ankle, flex your ankle, and the other leg. Any issues with those muscles down there?
None.
Fantastic. I'm going to have you hold your arms out in front of you, and I'm going to place your hands up towards the ceiling and have you close your eyes. And I'm going to be checking for any drift here in your hands. Everything looks fantastic. You can go ahead and close your eyes and relax. And can you squeeze my fingers for me? Very good. So your grips are equal, and your muscles all seem to be equal. Your tone is equal. Your joints don't seem to be tender or causing any difficulty. We felt your carotid pulses when we did your cardiac assessment. I'm just going to double check through your brachial, radial, popliteal, posterior tibial, and dorsalis pedis. And I don't feel any issues with your pulses at all. I'm going to have you go ahead and hop off the table and just bend over, touch your toes for me. I'm checking your range of motion. Very good. And you can take some steps towards the end of the table here, just regular, and turn around. So now when you come back, I want you to walk heel to toe like you're walking for a police officer for me. And any issues with any of that gait at all?
Nope, all felt okay.
Fantastic. Well, you seem to be in a perfectly good bill of health. You can have a seat back up on the table if you want. And if you don't have any other questions at all, you can head down to the lab to get that routine lab work that you asked for. And otherwise, I don't seem to find any issues at all here.
Perfect, thank you.
Does that sound good to you?
It does sound good.
All right, fantastic. It was a pleasure to meet you.
It's a pleasure seeing
Look
you.
forward to seeing you again, Mike.
Thank you.